This is a bad injury, but there's an even more serious injury he's not yet aware of. This patient is a 28-year-old male who was referred to my office for management of a mandible fracture. He was wrestling with his friend when he was slammed to the ground, striking his chin hard on the floor. The CT scan showed a fracture in the right condylar head of his mandible. I have great admiration for radiologists. However, I think Reagan said it best: trust but verify. I obtained a cone beam CT in my office, chiefly because I want to make sure there are no additional fractures anywhere else in his mandible. I scrolled through the images, and thankfully the rest of his mandible is intact. But there is a very important finding that I discovered. This is a fracture in the base of his skull. This is concerning because a basilar skull fracture can lead to intracranial bleeding and cerebrospinal fluid leak, both of which can lead to death. Thankfully, there was no CSF leak and there was no intracranial bleed. He was treated with prophylactic antibiotics, and the minor bleeding in his ear stopped after a few days. I treated this patient with MMF screws and wired him shut for only 2 weeks because it was a mild non-displaced fracture. He then adhered to a no-chew diet for 4 weeks, and at 6 weeks he was able to resume his normal diet and activity minus the wrestling. Everything healed well and he made a full recovery.